The Patient Voice, a Postscriptum. This short collection of videos on the patient voice has taken a little glance behind the curtain of the patient voice, a small insight beyond the slogans. Nothing that I said or included is the stuff of advanced learning. What I've written here about the assumptions around patient-centered care and empowerment is sophomore bachelor's reading at most. Any 101 level textbook would tell you this. It's interesting to note how circular the conversation is. What I have written here about patient empowerment is only regurgitated from books and papers I read decades ago, some of which were published as long ago as the 1950s. Why is it so circular? Why am I reading articles in 2025 such as cervical screening knowledge gap costing lives, or clinicians have been urged to move away from the doctor knows best view? In the latter article, it quotes the report jointly written by the Universities of Cambridge and King's College London that doctors are paternalistic to patients and should change to, quote, a more equal relationship where patients' lived experiences are taken on board, unquote. This is the kind of recommendation found in reports published 3 decades ago, and even then it felt tired. This is as tired as the well-worn cliche of the more things change, the more they remain the same. There is a difference amongst companies in how seriously each one takes the patient voice agenda, but I wonder what commitment there would be if there were no longer any regulatory pressures in place. Here's a thought experiment. Let's suppose, and remember this was written in around November 2024, so let's suppose that Trump 2.0 makes cut to FDA. That indirectly causes an unraveling of a raft of regulations and best practice guidance in relation to the patient voice, particularly in the area of diversity. Let's suppose this undoing has an impact on the ability of FDA to assess submissions where capacity may disappear altogether. The result is that patient voice initiatives are no longer expected or poorly regulated, no more RWE research required, no more cognitive debriefing or comprehension testing or REMS or anything to do with patient safety or health literacy. In this new reality, how many CROs and pharma companies do you think would still insist on the patient voice agenda in drug development? How many sponsors do you think would do it voluntarily? How many patient voice slogans decorate in their conference booths? You would count them on one hand. Thank you for listening. This was originally written by Mark Gibson, Leeds, United Kingdom, December 2024.